Special school board meeting for Monday, August 24th to order. We will note that public access to meetings during the public health emergency. We are strongly encouraging members of the public to attend remotely, and we provide information on the agenda as to how they can do so. The first item will be the roll call and verification of quorum.
Ms. Baker?
Here.
Mr. Pope?
Here.
Mr. Ebel?
Here.
Ms. Vang?
Here.
Ms. Portson?
Can you get this one?
Ms. Portson?
Barb, can you hear us?
Frozen.
It's something on your end.
Oops.
Are you on mute?
You know what, I can move down here.
Yeah, she's on mute.
Yeah.
Thanks. Can you unmute?
There,
Just say yes.
There you go.
Say here.
can you hear us now?
Ms. Portson?
Can you hear us? I think it's something on your end, Barb. It's something with your computer.
But her mic is off.
Are you on audio?
Muted, can you hear me?
Yeah.
Yes.
Now we can.
But are you on audio?
I can't hear you.
Is there a chat? Is there a way to chat?
Yeah, there's the chat.
Is Ann on? Can she hear you?
Yeah. Hey, Bert.
Ann, can you hear us?
Yes, I can hear the boardroom and I can also hear Barb.
Hey, Barb. Try logging out and logging back in.
Yeah.
Barb, if you're hooked up to another monitor, that might be the issue, if you just want to unhook from that monitor. I know I have that same problem.
I barely heard that, but did you say try a different machine?
Yes.
Are you using your Chromebook, Barb?
We'll try that.
Yep.
Maybe just go on and.
Now say something.
Can you hear us?
Yes, my grandson had headphones in.
Oh, yep. That'll do it. That'll do it. Okay, go ahead.
Ms. Portson?
Here.
Ms. Rano? Ms. Scott?
Here.
Mr. Wade? Ms. Erler?
Here. So we have a verification of, we have a quorum present. We will move into item 3, which is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I just want to note again for the meeting, the governor's order does allow members who are in a public place and who are 6 feet distance to take their masks off if they need to in order to communicate better. So we may be taking masks on and off as we are presenting tonight. We move into item 4, which is public comments. At the March 19, 2020 special school board meeting, the Stevens Point Area Public School District passed a motion to suspend school board policy 0167.3, public participation at board meetings for the duration of the public health crisis. Members of the public may provide public comment pertaining only to specific items on the agenda via emails at comments@pointschools.net. Did we receive any email comments for this evening?
There were no comments.
Okay, so there were no public comments for this evening. Moving into item 5. we've lost the superintendent.
On his way.
There he is.
Sorry.
He will.
So, we are in the superintendent's report, and I'll turn that over to Craig.
As Meg stated, the governor's order does allow us to take off the mask when we are talking on education issues, and we are practicing social distancing. So these are shields that we can also wear to add an additional protection. The order doesn't allow for these. However, it does allow the removal of the mask. And in our opinion, the removal of a mask while we socially distance adds another protection then of this particular mask. So I didn't have an opportunity to peel off this layer of film, so everyone's a little cloudy right now. And then it's going to be an attempt to do this without my glasses fogging up, which also works out quite well. So, excuse me for just stepping out for a moment there. We opened up our building to all of our new staff, or excuse me, our new teachers last week. We had approximately 45 new teachers for a week of professional development at Ben Franklin. Had an opportunity to meet all of our new teachers, and it was, again, very exciting to see the backgrounds that people are coming to Stevens Point Area Public School District. About a third are new teachers, and about 2/3 are veteran teachers coming to our area for a lot of different reasons. New staff in service begins tomorrow. Note that our reopening plan does allow for an additional week of professional development as teachers will be expected to prepare lessons for both in person as well as in many cases virtual as well. We also are going to have a gradual student start. Eventually, by the 8th, all of our students will be in seats, and I think it just makes good sense to have additional training as it relates to what this next year is going to look like. Quite frankly, regardless of the percentage of students in our building, whether you're food service or whether you're on the teaching staff, our employees are going to work harder than they ever have because of the nature of virtual learning, because of the protocols with food service. We're going to also be looking at grab-and-go meals, transportation of meals as well. Our transportation, our maintenance, our custodial staff in terms of the cleaning protocols, everything obviously is very, very different, and the expectations, quite frankly, that go along with that it increases the work capacity of all of our employees. We also have scheduled cabinet walkthroughs prior to the beginning of students coming in each one of our buildings, very similar to what we did for summer school. Spent a lot of time over the last couple weeks talking about athletics. The WIAA created a new athletic schedule. It shortened the winter season to be in February and March, January and February. It then created an additional winter season, spring season, if I may, for the option of postponing fall athletics for districts that are interested in doing that, and having fall athletics in March and April, and then spring will be in May and June. That was approved by the WIAA, I believe, a week or two ago. And many schools they're in that decision-making mode in terms of what they're going to look at doing. We met as Valley superintendents probably 3-4 times over the course of the last month, discussing a number of issues, but athletics as well. And it was agreed on by the superintendents that we would support the low-risk sports at this time, which actually started last week. Low-risk sports defined by the WIAA are cross-country, boys and girls, girls golf, and girls tennis. High-risk sports defined by the WIAA are girls swim, football, soccer, and volleyball. As a conference, we decided we aren't going to begin any of our sports until September 1st. So those schools are involved with low-risk sports, and there certainly are many school districts throughout the state of Wisconsin. They started athletics last week. We'll start a low risk on September 1st and high risk in the event that we choose to do that, September 8th. The Wausau schools are virtual. They'll be making a decision tonight in terms of what that will look like. Appleton West is in our conference this year. They're virtual, so they will not be playing high risk or low risk. We have another Valley Athletic Director meeting tomorrow. Superintendents will meet again then on Thursday, and I'll have a final decision. And I will notify you as a board prior to making a public announcement on that. I will say that I met with 5 key administrators from our own district this afternoon and had a lengthy discussion, not only today, but individual discussions over the last couple of weeks. And I can say that there's a level of concern with bringing high-risk sports into our school system this year. So a final decision will be made at the end of this week. And it'll be a very, very, very painful decision because it affects so many kids, including junior high students. It all ties into our main objective, and that's to get our children, our students, our kids back in school in front of a classroom teacher in the safest possible manner. And when you talk about high risk anything, I think I can comfortably say there's a risk with everything in terms of opening up schools in general, but certainly with COVID-19 there's a risk. But I think what we're making very tough decisions when there aren't a lot of good choices out there. But we are making decisions based on low risk as it relates to everything we're trying to accomplish. So, but an affirmative decision will be given later in the week. That I believe is my report. I did state that we likely will be able to do grab and go. There were some federal waivers on that, and so that'll be a good thing, especially for those students that will be either virtual at the elementary on Wednesdays as well as at the secondary level when they'll be at home 3 days a week, 2 days in school. Are there any questions for me?
Craig, say again what the high risk ones are.
High risk sports are swim, football, soccer, and volleyball.
Okay. Thank you.
Craig, can I ask for a clarification on the grab-and-go meals? Will we be serving food in each of our buildings?
Yes.
And will we also be doing the grab-and-go? Because in the
Yes.
buildings, there will be kids, but there will also be kids doing virtual.
Yes,
So we'll be doing both
correct.
and delivering with school buses again?
Yes,
Oh, boy.
that'd be a challenge.
Yeah.
But, yeah,
More kudos
our
to...
people think we can do it, so.
Yeah, more
Tom
kudos
and-
to Lori and our food staff.
And Lori and Mr. Budzinski.
May I offer a clarification on the language for the meals?
Sure.
I just want to be really clear that the grab and go meals were free meals.
Oh, thank
And
you.
the meals that we'll be able to offer they'll be charged just like we typically would during the course of a regular school year. So those will be made available to students who need to come in. We're working on communication for that right now. That should go out Wednesday or Thursday of what that process looks like for families. So we'll include, they can come to schools to pick them up. We'll also have additional bus stops, and families who need assistance are encouraged to apply for the free and reduced meal application if that applies to their family.
Sarah,
Thank you, Sarah. That's very important information, and that, of course, is determined by the federal government.
Sure, but how will that happen out at the grab-and-go locations where the buses? I mean, now I think there's a card reader, right?
Logistics,
Yeah.
yeah.
Do you understand what?
Those have been worked out. I had a really good conversation with both Mrs. Epstein and Miss Orley this morning about how we have a form put together. We'll have families who are interested in that option would complete one weekly.
Got
for
it.
each student, and then that information would be provided to drivers, and we just check them off and then charge accounts accordingly.
Got it. Okay. And you'll
We've got a system in place.
and you'll do more communication on that for families, like
Yeah,
on
we've not
Facebook and
heard it
such.
yet. Honestly, that was finalized this morning. So we wanted to make sure that that information was out there. It's certainly a concern for some of our families. So we're working on making sure we have that put together in a way that makes sense for folks, and then we'll be getting that out. Like I said, our goal is Wednesday of this week.
Great. Thank you.
Hey, Craig, I have a question for you. You are wearing a face shield. Now, for students going back to school, are face shields sufficient in place of face masks, or is it just face masks that are required?
The governor's order does not include a face shield. It requires a face mask. The reason I'm wearing one, the order doesn't require me to wear one right now because I'm socially distanced. I'm wearing it out of respect for my colleagues because it does add a level of protection, but it allows me also to communicate more effectively than wearing this. And so we have decisions that we have to make yet as it relates to this shield and teaching, for example. The order will allow a high school teacher to stand up and teach in front of their class, assuming they're 6 feet apart. We may, however, to remove this, go above and beyond the governor's order and require the mask. It may assist us in people having to explain why they're not wearing something. We also have some flexibility with students that have health conditions if you have a health condition, you can be exempt from the mask with a doctor's authorization. Well, then we could require the shield, and we have the authority to do that. Quite frankly, if we have students that have medical issues that are documented, we also have the authority to say, if you can't wear this mask, you have to be virtually learning. And quite frankly, that's a decision that, as a cabinet, we're going to make tomorrow. Unless we feel comfortable, if you can't wear a mask, are we okay with this? But we know that we're going to have students, just like we do community, arguing about whether or not we should wear this. And if you're in our school without a mask as a student, that's going to cause some issues. That very well could cause. Why do you not have to wear one, but I do? Well, it's a medical issue. It's none of your business. But we're going to have to deal with that. So if we're able to wear this, it might be sufficient, or quite frankly, as a cabinet, we may make a decision. If you can't wear a mask because of medical reasons, unfortunately, you have to virtually learn, and I have clearance from our legal counsel that we can do that. So those are tough, a very good question, and a tough one to
A question going off of that with social distancing in classroom. Would teachers have the options to take their classrooms outside and teach to provide more space in between each learner?
We are going to maximize outdoor learning to the extent that we can. Of course, that'll be dependent maybe on the subject. That might be dependent on each particular school because green spaces are quite different from building to building. But the answer to that is yes.
Okay, thank you.
Any other board members with questions? Craig, I just have one question with respect to Wednesdays for our little ones. We clearly have students within this community whose parents have to work Monday through Friday. Are you aware of any conversations we're having with local providers?
Yeah,
about
thank
safe
you.
spaces
And I
for-
know you're there, Corey. You had a meeting last week with the YMCA and the Boys and Girls Club. The quick answer is yes, we have programming available, and I'm going to have Corey, if I may, go in greater detail.
Sure.
So several of our community partners have let us know that they can most definitely take school-age kids on Wednesdays. So Sherry Stanchek has been in touch with some of our community partners that we work with the 4K program, but then specifically as it pertains to the YMCA and Boys and Girls Club, they are working on a program together that will not only take care of childcare, but will also help with e-learning support. Between those two programs, they think it can service 226 kids between the main YMCA site, the Burrard Center, the Plover Boys and Girls Club, and Kennedy School. We're in the process right now of finalizing if they're going to take advantage of our food service and then we utilize our drop-off locations to take the meals there, or if the Boys and Girls Club is going to provide the meal service for both the Y and the Boys and Girls Club. Because of licensing, K2 students will go to the Y and 3-6 students will go to the Boys and Girls Club unless there's families that have to be together. So we've got a plan in place. They're going to start communicating this week. They're thinking of charging $10 per day per family. If a family qualifies for free and reduced lunch, it will be free.
Thank you.
Yep.
Are there any other questions with respect to that part of Craig's report? Then I'm going to turn him over for his second part of his report, which is an update on the executive assistant to the superintendent's office.
Carlin Kramer is coming back.
Yay.
Yeah, Carlin notified us as soon as she found out that Heidi was moving on, and is excited to come back. And we interviewed a number of people. Jeff was in on that, and at the end of the day, it's like the obvious is sitting right there. She has done an outstanding job in the school district for many, many years. Knows what's going on in the transition period during COVID-19 will be very quick. I've known Carlin obviously since I've been here, and I'm excited to get her in here ASAP. Mayor Mike's probably not real happy with me, yet I did talk with Mike last week, and we're going to work out a schedule as we did when she left to kind of help them out as she starts here and do a gradual reinstatement, if I may. So, welcome, Carlin.
Do you have a start date for her?
No.
Okay.
Put me on the spot there.
Sometime within the
I would
next-
expect sometime this week we'll get her in here and meet with HR and get that stuff off the ground, and then likely by the beginning of next week we'll have a schedule put into place, probably for a couple weeks. So that's exciting.
Yep. Any questions from board members with respect to that? Welcome, Carlin, if you're watching. Welcome back. Moving on to item 6, which is our consent agenda. We have the minutes of the August 10th, 2020 regular school board meeting, employment recommendations. Do I have a motion to approve the consent agenda?
Move to approve the consent agenda, both items.
Motion by Baker. Do I have a second?
Second.
Second by Scott. Any questions or discussions with respect to the consent agenda? All those in favor with aye?
Aye.
All those opposed? The consent agenda is passed. We are moving into item 7, student services, the 2020-2021 district nursing proposal update.
Yes, you'll recall that we implemented a new structure a couple months ago. And we found out, quite frankly, that implementing it this summer with COVID-19 was very difficult. We had candidates that you'll recall that our last plan supported a district coordinator as well as a district nurse supplemented by part-time health aides. And the people that, quite frankly, we were interested in hiring stepped back and saying, I'm very interested in coming to work. However, we just believe your plan needs to be supported with more more certified RNs. So I'm coming back to ask that we amend or approve the hiring of 3 full-time nurses. Again, the last proposal was 2 full-time nurses. 3 full-time nurses, and then we would supplement that as well with 10 part-time health aides. And we're also requesting that we hire a temporary coordinator. Quite frankly, that's Kathy Reynolds. When we started learning that, we're having a difficult time staffing this right now, and school's right around the corner. I called Kathy up and had a lengthy conversation, asked her, she's retired. She's been running our program here for years. If she would come back, and she said, would be happy to. However, you really need to hire an additional nurse, Craig, to make this work out. So if you approve this tonight, and I highly encourage you to, it is cost neutral based on just changing the structure in which we're hiring, except for Kathy's position. Kathy's agreeing, I'm looking at this as part-time help. Kathy's agreed to work part-time, 20 hours a week, guaranteed 1 month up to the first quarter up to the entire school year. And of course, part of it is if we get into the end of the first quarter and maybe we're not in session, we would rethink whether or not we need that additional staff person, but we would do it quarter by quarter, and she's agreed to that. So this would allow us to hire 3 FTE nurses and the temporary half-time position, which would be Kathy Reynolds. Questions?
Yeah, I just need a clarification. When I'm looking at the summary here, it says 1 district nurse at Spash, Charles Fernandez, 1 district nurse for the junior highs. Is that 1 nurse at each junior high?
No, that's split.
Where's the 3rd district nurse? Where's the 3rd RN?
The 3rd would oversee the elementary schools with
Okay.
the health aides.
Okay, that's okay, got it, I see. You just
And the
written differently.
SPASH would be the same as last year, as well as the district nurses. Actually, Kathy did the 2 junior highs last year with 4K. Kathy
So-
indicated that she would do 4K right now.
Okay. So the only, I mean, you're moving things around a little bit, but the only real addition is Kathy as a part-time coordinator, right?
Well, and there's clarification. Kathy is going to be a contractor with the district.
Right.
She is not going to be an employee of the district.
Yeah,
She is
but-
going to provide consulting services with respect to the creation of the program, the supportive of the hiring.
I understand.
Yes.
I'm just saying, from what was presented to us, 2 months ago, the only difference between this and what was presented to us 2 months, I think it was 2 months ago, is that there is now a part-time coordinator.
And an additional
2 months
RN.
ago, it was
Oh, okay.
And 1 additional RN.
2 RNs. Now it's
3.
3.5 if you count Kathy as a temporary.
Yeah, okay.
So it really is changing it up. It's
Okay.
adding another RN.
And the additional cost, I get what I'm really getting at is the additional cost of making these changes.
Based on, just based on a number of things, including increasing an RN, decreasing time for health aides, it really is a wash, right down to the T, except for Kathy's position. That'll be an addition. And then we'll revisit this in the spring in terms of what that part-time coordinator position is going to look like. Is it something where we want to continue that? We'd bring that forward. Or whether somebody internally has the capacity of taking over that leadership as well. That very well could happen. But keep in mind right now, and maybe I had my blinders on to this during the summer, Kathy Reynolds has been here for a long time. I brought Kathy's name up in June, right when we got out of the gate with this. I said, why don't I just call Kathy and we'll just get her involved? And then we said, let's give this some time to see who does apply. And then the summer got away, and the people that applied really felt like we needed another structure. And I called Kathy and said, Kathy, I need some help right now. And she listed off a handful of things that would get done, tomorrow.
Great.
Need to get done, so.
Good. I just want to make sure there's money for it, but, I mean, my feeling is probably it's going to be springtime and we're going to say, you know what, that position needs to continue. But we got a really unique person, and so we'll cross that bridge when
Yeah.
we get to it. Good, thank you.
I had a question also, Greg, with Kathy Reynolds. She's apparently going to be involved in planning and setting the program out. Will she also be doing face-to-face duties as the other nurses with the kids?
Likely not.
Okay.
Again, she's the coordinator. Likely not 20 hours a week. She'll have her hands full. And of course, part of that is the structure's a little different than it used to be. She may find out now that things are up and running and we've got 20 hours a week, she may be able to. She'll also be able to do some of this virtually, because it's planning. So we want to maximize the face-to-face time between our nurses and staff and students to the extent that we can, but that really was set up with the main purpose of planning and coordinating.
I also had a question about the health aide position, the nature of it. Is that somebody that's being hired for that job, or is that somebody already hired at the school who will take on those duties?
There'll be new positions, but they could be some people that we already have. But we aren't taking somebody out of a classroom to make them a health aide.
Or out of a secretary job or something like that?
No, we aren't going to take them out of current positions.
Okay.
Again, when we approved this, obviously everything's a financial decision. We believe we could restructure and have more hours in front of students. The county's contract, I believe, had 7 nurses. We have 3.5, but those 7 nurses were not FTEs either. They were part-time positions here and there. So when we took the FTE hours out of our RNs and added the face-to-face of our health aides, we actually significantly increased the time that somebody will be in the office when somebody gets sick. Now, granted, it'll be less RN time, but increased resource overall.
Any other questions from board members of Craig?
Oh, do you need a motion?
Yep.
Move to approve the restructuring of the 2021 nursing plan that includes a temporary part-time nurse coordinator, 3 FTE district nurses, and elementary office health aides for the 2021 school year in lieu of contracting with Portage County Health and Human Services.
Do I have a second?
Second.
Second by Pope. Any further discussion or questions with respect to this item?
Could you ask for a friendly amendment to specifically say Kathy Reynolds will be the part-time position? Then we don't have to go into closed session.
You mean that it will be a contract position?
No, it'll be a part-time position. But then that was the purpose of going in. Then we don't have to go in closed session tonight.
So where it says includes a temporary part-time nurse coordinator.
That's what she said, temporary part-time nurse coordinator. That's already in the motion.
Got it?
To be Kathy Reynolds? Do you want me to add that?
Yes.
Yes.
Okay, so I will amend my motion between the words coordinator and 3
Got it.
to be Kathy Reynolds.
Thank you.
G, will you second that amendment?
Yes.
Good.
Any further questions or comments? All those in favor with aye?
Aye.
Opposed? Motion carries. Based on that, we do not need to go into closed session this evening, so we will move past that item. And we will move into adjournment. Could I have a motion to adjourn?
Move to adjourn.
Second.
All right, all those in favor with aye?
Aye.
We're adjourned. Thanks, everyone, for taking time out for the special meeting. Really, really appreciate it.
Thanks, everyone. Appreciate it.